Tricore is a little bit of a unique company in that we are a payroll and also a benefits company. So we're one of the few companies that manage both for our employers. Typically our employers are what we call the mid-market, which is anywhere between 500 and 1,000 employees. So employers are getting squeezed, typically more and more. The cost of healthcare continues to go up anywhere between 8 and 20%, depending on your market, depending on where you are in the country. This year, on average, our employers have seen about a 12% increase. So the double-digit increases are becoming more and more of a burden. Everyone has tried to do what they can to manage costs from a employee sharing standpoint, and continuing to push the burden back onto the employee. And that has, since become, a burden for the employee. So now, to attract good employees, they're trying to think about what they can do to bring down the cost of healthcare, and being able to get more and more involved in their plan and what they are and what they're not going to pay for. Employers are starting to look, a little bit differently than they used to in the past, because they have no choice. The employees have seen their healthcare costs rise about as much as they can, and the employers have also taken on about as much burden as they can. So now they're looking at things that they can do and strategies that they can take to make sure that they're providing the right benefits to the right people. They're looking at self-insuring certain portions of the deductible, and also trying to take a hard look at what they are and what they're not going to pay for going forward in the future. And lots of different kinds of conversations that different employers are having to really try and bring down cost. Cost is continuing to be a burden, especially for the mid-market.